Millions of people suffering from back pain are told prescription drugs, injections, or surgery are their only options. But an emerging non-surgical technology called spinal decompression therapy is gaining support in the medical community and giving back pain patients new hope. And now, here's news anchor Ren Scott.
Hello everyone, I'm Ren Scott, and welcome to this special broadcast on the growing epidemic of back pain in this country and an emerging treatment that a growing number of doctors are now using to effectively treat back pain without drugs and without surgery. As an Emmy Award-winning news anchor and journalist, I've dedicated 18 years to researching and reporting stories that I feel are important and could have a major impact on people's lives. And a few years ago, when I started to suffer from severe lower back pain, I was stunned to learn just how many other people are suffering with back pain and feel they only have the limited options of living with the pain or depending on medications to mask the pain, getting epidural injections, or eventually even turning to surgery. But in my case, I was fortunate to get some very good medical advice to look into another treatment, a non-invasive treatment called spinal decompression therapy. And for me, it provided remarkable results. With that in mind, we decided it could be of great value to produce a program that educates the millions of back pain sufferers about the science of spinal decompression therapy so they can explore this non-invasive treatment for back pain and see if it's right for them before committing to medications, injections, and certainly before surgery. During spinal decompression therapy, a patient reclines and a gentle pull calculated specifically for that individual patient works in an effort to relieve pressure between discs and allow the back to begin a natural healing process.
It wasn't painful at all. It was very comforting. I felt, in the pulling just kind of helped ease some of the pain, ease some of the pressure that was going on. So I always looked forward to getting on the machine.
After the treatment, I really missed coming and being treated like I was at a spa. The treatment was very comfortable and it was very relaxing. At the end of some of the treatments, you felt like you had been through a good workout, like you had gone to the gym and worked out.
So who is a candidate for this procedure? Well, the literature on spinal decompression therapy says it can provide relief for herniated discs, degenerative discs, sciatica, general lower back pain, and even failed back surgery. In my research for this report, I interviewed well over 200 patients, including patients with each one of those conditions. And I heard story after story that convinced me that anyone suffering from back pain should at least explore spinal decompression therapy before deciding on a treatment. One of the surprising findings in preparing for this broadcast was just how many people are uninformed about spinal decompression therapy, including many doctors and surgeons. To find out why, I traveled to Connecticut to visit with Dr. Raymond Sakaguchi. Dr. Sakaguchi is the director of the Family Practice Division at the prestigious Greenwich Hospital and a strong advocate for spinal decompression therapy. He explains that doctors are often skeptical of new technology, so change is often slow in the medical community. But in 5 years, he believes, 50% of all primary care physicians will have a spinal decompression system in their office.
Some physicians are probably too interested in what they're doing and not curious enough to look around to look for other options of treating their patients. I think that if we can offer the patient something that they have not used before, that could be a tremendous help for them to avoid them from having unnecessary surgery. I think that we're doing them a big service.
Another finding for this report, many patients I talked with told me that their doctor told them that surgery was their only option, when that simply was not the case. And joining me now is Dr. Louis Crespo. Dr. Crespo is president of the National Spine Centers and a member of the National Academy of Pain Management. Dr. Crespo, thanks so much for joining us. We've been talking about the success stories of spinal decompression therapy. Let's talk about the science behind it and exactly how it works.
Before we talk about the science behind it, let's review the anatomy of what we're trying to fix. This is a picture of your lower back. The lower back has bones, which are called vertebrae. They have discs, which separate the space between the bones, and they have nerves. The disc is like a jelly donut. When you put too much pressure on it, the jelly squirts out. When it does that, it can touch the nerve and cause pain in the back, in the lower back, or down your legs. The object or the science behind spinal decompression is to be able to take the disc that's affected and relieve the pressure on that disc by gently distracting the two bones, the one on the top, the one on the bottom, creating a negative pressure inside that disc and allowing for the jelly to go back in its place.
Now, when you think of pulling the spine, an awful lot of people think of traction, and in fact, there's a substantial difference between traction and spinal decompression therapy. What is the difference?
The main difference is that with traction as we know it, for years, just puts a general load pulling the entire spine. It does not differentiate between the different levels of the discs. By using motorized spinal decompression, we're able to change the angle of the pull and target specifically the disc that's affected. And that you get much better results than with just standard traction.
Now, I know talking to people around the country, they'd say, well, this is kind of a rack and it's going to pull me and that's going to hurt. Now, I know for me it was a very comfortable experience. What is the comfort level for the majority of your patients?
My patients, when they come in, are a little apprehensive the first time that they get on the machine. Once they get on it, they all react the same way. There is an immediate sense of relief once the machine starts to pull, and they look at you and go, my pain's gone. After that, it's just a matter of they get comfortable with it, and the majority of them sleep through the procedure.
Here's another story of a patient whose life was changed by spinal decompression therapy. And again, we want to let our viewers know how to contact the spinal decompression experts in their local area. For many, to see Angie Horton water skiing again is nothing short of a medical miracle. That's because just a few years ago, she was recuperating from her third spine surgery and living in constant pain.
I really felt that I had two options. It was either a wheelchair or death. I literally felt I was going to end up being a crippled person. I was headed in that direction. I'm very glad I did not go under a fourth spinal surgery.
It was while recovering from the third surgery that Angie read an article that introduced her to the science of spinal decompression therapy, and she began the treatments that would change her life.
I have always said that I don't use the word miracle. I think only someone above gets that word. But I would say it is honestly as close to that word as you'll ever get.
Within hours of her first treatment, Angie says she started to feel relief. And by the end of her 6-week spinal decompression therapy, she was completely pain-free.
Here we go.
Now, being able to play with her grandchildren and live an active lifestyle, she wonders why her surgeon and other medical experts didn't tell her about spinal decompression therapy sooner.
I actually got to a point where I became actually angry. You know, I went through a couple weeks of anger simply because I felt that other people in the medical field were obligated to give me the information that I felt that they should have known.
Look, who's that baby?
So now Angie dedicates herself to enjoying the lifestyle she almost lost and spreading the word of how non-invasive spinal decompression therapy accomplished what her 3 spine surgeries never could.
Not against surgery, not against all the other things, epidurals, but I feel that they should not be on the forefront. They should be on the back burner. These spinal decompression machines should be the first thing once you have a proper diagnosis with an MRI, and if a patient's a candidate, it should be the very first thing that they do.
Welcome back once again to our discussion with Dr. Louis Crespo on spinal decompression therapy. And Doctor, we've been talking about spinal decompression for the lower back or the lumbar, but it can also be very effective for the neck or cervical.
Yes, it can. We started doing cervical decompression approximately 2 years ago and have been very successful with the patients that we've treated.
Let's talk about the philosophy. Any differences in how it works for the neck versus how it works for the back?
Basically the same. We use the same curvature in the neck that we have in the lower back. The back's got this nice gentle curve, and so does the neck. By placing the patient on the machine and pulling at the base of the skull, we can change the angle of the pull to specifically get one level or another that is effective.
And the future for spinal decompression, what do you think? Growing tremendously? What will we see in the next few years?
The future for spinal decompression, this type of treatment is at its infancy. I see an explosion of spinal decompression, not only in the United States, but worldwide, because we're able to give a patient choices that they didn't have before.
When it comes to your health, you should explore all options. And when it comes to back or neck pain, many experts will tell you that non-invasive spinal decompression therapy is the logical, conservative first step before committing to prescription medications, epidurals, and certainly before surgery.